Nestled amidst the rolling hills of western West Virginia stands an imposing Gothic revival structure. This is no ordinary building. It is the Trans-Allegheny Lunatic Asylum, a place shrouded in history, sorrow, and chilling tales. Completed in 1864, the asylum was initially known as the Trans-Allegheny Lunatic Asylum. It was later renamed Western State Hospital, reflecting changing attitudes towards mental health. Today, it stands as a stark reminder of our evolving understanding and treatment of mental illness. The asylum's story is one of both hope and despair. It began with noble intentions. The goal was to create a sanctuary for the mentally ill, a place where they could receive compassionate care and treatment. The asylum's founders envisioned a haven where patients could heal. They wanted to provide a humane alternative to the often cruel conditions found in other institutions of the time. The location itself was chosen for its tranquility. The sprawling 242-acre site on a hilltop overlooking the West Fork River was considered ideal for healing. The fresh air, scenic views, and peaceful surroundings were thought to have therapeutic benefits. It was believed that nature could soothe troubled minds. The asylum's founders spared no expense in its construction. They envisioned a grand and imposing structure that would inspire awe and instill confidence in its patients. The building was designed to be a symbol of hope for those struggling with mental illness. They believed that a beautiful and well-maintained environment could contribute to the well-being of the patients. The Trans-Allegheny Lunatic Asylum was designed according to the Kirkbride plan. This architectural model was developed by Dr. Thomas Story Kirkbride, a prominent 19th century psychiatrist. Kirkbride believed that architecture could play a crucial role in the treatment of mental illness. His design principles emphasized spaciousness, natural light, and ventilation. These elements were considered essential for creating a therapeutic environment. The Kirkbride plan called for long, rambling wings arranged in a staggered formation. This design maximized sunlight exposure and fresh air circulation. Each wing was intended to house a specific classification of patients. This segregation was based on the severity of their illness and their perceived need for supervision. The asylum's central administration building was designed as the nerve center of the institution. It housed the superintendent's office, medical staff quarters, and other administrative functions. From this central hub, the staff could oversee the entire facility and ensure the smooth operation of the asylum. The Kirkbride plan, with its emphasis on spaciousness and natural light, reflected a growing understanding of the importance of the environment in mental health care. It marked a significant shift from the cramped and often inhumane conditions found in earlier asylums. The construction of the Trans-Allegheny Lunatic Asylum was a massive undertaking. It took over 2 decades to complete. Work began in 1858, and the first patients were admitted in 1864, even though the building was not yet finished. The asylum's construction was a testament to the ambitious vision of its founders and the skill of the craftsmen involved. The asylum's design incorporated elements of Gothic revival architecture, a popular style during the mid-19th century. This architectural style, characterized by its pointed arches, vaulted ceilings, and ornate details, was often used for institutional buildings. The use of red brick, locally quarried sandstone, and cast iron elements further contributed to the asylum's imposing presence. The asylum's interior was equally impressive, featuring spacious rooms, high ceilings, and large windows that allowed natural light to flood in. The walls were painted in calming colors, and the floors were covered in durable materials, reflecting the attention to detail that went into creating a therapeutic environment. However, the asylum's construction was not without its challenges. The Civil War disrupted the supply chain, delaying the delivery of materials and equipment. Labor shortages also posed significant obstacles. Despite these setbacks, construction continued, driven by the pressing need for a facility to care for the growing number of mentally ill individuals in the state. In its early years, the Trans-Allegheny Lunatic Asylum was at the forefront of mental health care. Dr. Richard Hills, the asylum's first superintendent, was a strong advocate for moral treatment. This approach emphasized compassion, respect, and therapeutic activities. Dr. Hills believed in treating patients with dignity and providing them with opportunities for recreation, education, and social interaction. Patients were encouraged to participate in a variety of activities designed to engage their minds and bodies. These activities included gardening, farming, sewing, woodworking, and music. The asylum had its own bakery, laundry, and farm, providing patients with opportunities for meaningful work and contributing to the self-sufficiency of the institution. The asylum's idyllic setting, with its sprawling grounds and serene views, provided a tranquil backdrop for healing. Patients were encouraged to spend time outdoors, enjoying the fresh air and engaging in leisurely pursuits. The asylum's library offered a sanctuary for quiet reflection and intellectual stimulation. The early years of the Trans-Allegheny Lunatic Asylum were a testament to the belief that with compassionate care, even the most troubled minds could find solace and healing. The asylum's founders and staff were driven by a genuine desire to improve the lives of those entrusted to their care.